You're watching Stroke Smart on ABC 27, brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. Star basketball player Corey Weissman couldn't believe what had happened to him. At age 19, he had a stroke. Corey made remarkable strides in rehab, but this was just one step in the recovery process. Doctors needed to take care of the problem that caused the stroke.
Corey had a ruptured arteriovenous malformation. I talked to Corey and his family about the options of either microsurgery, actually taking the AVM out, or radiosurgery, treating it with the gamma knife, and felt that his best option was microsurgery, and he agreed to proceed with that.
Dr. Harbaugh was confident that he would be able to take this AVM out, and that's the right way to do it because Corey's young and he shouldn't have anything like that in his brain and never have to worry about it again once it's removed.
You know, I was excited to have brain surgery. It sounds crazy, but the whole time that I was at Kessler, I had to worry about the AVM that I still had because it was glued. It wasn't, you know, it wasn't gone. I still had it.
Before they wheeled him away, he goes, "Okay, I'll see you later, Pops." He would call me Pops, and we bumped knuckles or something, or did a high five, and I gave him a kiss on the forehead, and I said, "I'll see you later."
The surgery entails taking off a piece of bone, piece of the skull, and then going to where the AVM is in the brain. You don't have to go through any part of the brain because it comes to the surface. And working around the AVM to actually remove all the abnormal vessels, but not disturb any of the surrounding brain.
After about 7 hours in surgery, Dr. Harbaugh told Corey's parents the good news.
It went really well. Easy to localize this. It wasn't a particularly difficult AVM. Fairly small, came out nicely, and you know, I think he went home in about 3 or 4 days.
Corey didn't waste any time. He was determined to return to school in the fall, and he did.
I went into Coach Petrie's office and I told him that I probably wouldn't be able to play that year, but I would be the hardest working player on the scout team. Went to practice every single day. At first I helped operate the clock and the shot clock for practice.
Coach Petrie brought him along slowly. Corey was keeping score for them and doing stats and maybe helping critique some of the players.
Then it graduated to being able to warm up before games.
A lot of dedication and hard work that paid off during Corey's last game of his senior year.
I gave Corey a call and told him I was going to start him in the game. And, you know, he was appreciative of everything, but I don't think it hit him until after he hung up.
The emotions that I felt at that time were indescribable. I set a goal for myself. It's what I wanted to do from the start. And here I am, after all this work, hard work, I'm going to get back on the court tomorrow. I did it. So, I mean, there was just tears of joy that just wouldn't stop.
We worked something out with Coach Nuge till we could, start the game, get him in, get him out, and okay, that'd be it.
A great ending, but the story wasn't over. With less than a minute in the game, Gettysburg was ahead and Corey was put back in. The plan was to purposely foul Corey.
Corey Weissman is fouled by Flanagan, and he'll head to the free throw line.
We go out, and I get the ball, and a player on Washington fouls me. We were in the double bonus, so I had a chance to go to the free throw line and take 2 free throws.
He's standing at that foul line. I'm like, oh, baby, you're going to do this.
Everyone in the stands is standing to see Corey Weissman shoot 2 from the line.
I was a little nervous on that first one, but once I missed that first one, I was 100% positive that the next one was going in.
Got into his stance, and I said, that's going in. And then swish.
And the second attempt is good. Corey Weissman makes the free throw, and the crowd erupts.
When the ball went through the net, it was just an unbelievable feeling that I'll never forget. It's the greatest day of my life.
Such an inspiring story. Corey's story has been seen nationally. In fact, a movie is being made about his determination. It's called 1000-1, the Corey Weissman story. The film is expected to be released later this year. And joining us right now is Corey Weissman. Thanks for driving in from New Jersey.
Thank you for having me. I appreciate it.
How does it feel to have a movie being made about you?
It is so surreal, I can't even begin to describe it. But it's also an amazing opportunity to spread my story and hopefully inspire others across the country.
And how are you inspiring people right now?
I actually have one of my good friends, 9-year-old boy down in Georgia. His name is Will. He had a similar injury to mine, and we've stayed in close contact, and I've been able to motivate him and tell him to stay positive. And he's one of the reasons why I'm actually planning to move out to California and pursue a career in public speaking to hopefully spread my story even more.
Okay, Corey, thanks so much, and thanks again for joining us. Chuck, back to you.
It's a remarkable story, I'll tell you. And Corey has made a remarkable recovery. And now joining us, the other co-director of the Stroke Center, Dr. Kevin Cockcroft. Doctor, we showed there that Corey had surgery after the stroke. Is surgery always required?
Actually, it's not always required. In fact, many of the patients will not need any surgical procedure. For instance, in Corey's case, where you have a bleeding type of stroke, many of those patients can just be admitted to our intensive care unit, watched carefully for several days, and have their blood pressure controlled. For the more common types of stroke, the ischemic stroke, in that case, the mainstay of treatment is a drug given simply through a vein, the clot-busting drug that you heard about earlier.
Now, is surgery sometimes the only option?
It's rare that surgery is the only option, but sometimes it's the best option. And that may be in situations like Corey's, where the brain pressure goes up so much because of the bleeding clot, and so the clot needs to be taken out, or the brain needs to be given some room to swell.
We showed him with the rehab. Talk about that. That seems, to me, it would seem vitally important.
Absolutely. That's one of the most important things for a patient's recovery after a stroke. And that involves several different aspects. There's physical therapy, occupational therapy, and speech therapy. And then some people even have a cognitive therapy, which is basically a therapy to improve their thinking and their memory, which is oftentimes a problem after a stroke like this.
Now, are there elective treatments for patients that might be high-risk stroke patients?
Yeah, so sometimes the risk factors that you heard about earlier in the prevention techniques like diet, exercise, and medicines are not enough. A procedure is required. Actually, the most common procedure to help prevent a stroke is a procedure on the arteries in the neck, a carotid endarterectomy. And that involves opening the artery and cleaning out the plaque or clot that has developed in that artery over the years. There's also a version of that can be done with a catheter. That's called carotid angioplasty and stenting. And then there are other procedures to prevent the hemorrhagic types of stroke, such as clipping or coiling of a brain aneurysm to block those off, or embolizing and taking out a brain AVM like Corey had.
Okay, we're going to break right here. We're going to go back over to ABC 27 call center with Deborah. Deborah?
Thanks, Chuck. Here is our last viewer question. I am a woman in my 30s. I have a friend the same age who recently had a stroke and was told it was due to her taking birth control pills. Am I at risk?
You are if you're taking the birth control pill. It's a type of hormone therapy. Women who take hormone therapy, whether it be birth control pill or hormone replacement therapy, should be paying close attention to their family history and what their risk factors are and managing them.
Okay, great. Thanks for answering our questions tonight. We also want to thank the specialists for answering their questions. If the phone lines are too busy, you can email your question during the show to questions@abc27.com. And as we did hear, seconds count when it comes to a stroke. The Penn State Hershey Stroke Center has developed a new way to help local hospitals give stroke patients the care they need when time matters the most.
Telemedicine is a newer technology allowing outside hospital systems to interact with academic centers.
It's going to provide real-time audio-visual access between our physicians here at Penn State Hershey and the physicians, the patients, and the patient's family in the community hospital emergency room departments.
There's a clot buster called intravenous TPA, which is the standard of care for many acute stroke patients, but unfortunately, if you go to a rural hospital setting to where doctors, staff aren't familiar with the drug or the use of the drug, by the time patients are transferred to another facility, often they're beyond the appropriate treatment window.
Anytime that we're thinking about a stroke, we're thinking time is brain. Our treatment decisions are extremely time sensitive, and the faster that we can make the best informed treatment decision, we're going to be able to have the best outcomes.
Not only will we be now able to see, evaluate, and examine the patient, but we will be able to see the brain and vascular images of that particular patient and probably formulate the most precise diagnosis and treatment plan.
It really brings our physicians into the emergency departments in our community hospitals. I do really think that this is a wave of the future. Access to specialty care is limited, and location should never determine access to that care. And one way to provide that is to provide a telemedicine service, so that it doesn't matter if you're at Penn State Hershey or if you're in Ephrata, that they can still have the same access to the specialist.
And this program started this past summer already. There are 3 hospitals on board. By this summer, 10 additional hospitals are expected. Chuck?
Well, Deborah, we were talking about telemedicine, and that's a whole new avenue of help for patients. Let's talk about that. How has that changed the way patients are treated now?
So this is having a huge impact on how patients are treated, particularly with ischemic stroke. So we talked about a drug, TPA, this clot-busting drug. Well, it's had several problems. One of them, it needs to be given within 3 to 4 hours of a stroke, and that's hard to get patients in that early. The next problem is that many doctors out in the community are uncomfortable with the drug. They're worried that they don't know the right patient to give it to, or they're worried that the drug may cause bleeding. So what telemedicine allows us to do is basically have a stroke neurologist or a stroke neurosurgeon from Hershey Medical Center present in the emergency department at another hospital via this two-way audiovisual communication system. So they can help the outside physician make a decision, they can help them evaluate the patient, review the CAT scan, and so the patient is able to get this drug early on, and sometimes even without having to be transferred to Hershey Medical Center.
And very quickly, just sum up, what makes Penn State Hershey Stroke Center unique or different from other stroke?
So there are several things, and you have a graphic that will be coming up, and it's going to show a whole list of things. But perhaps the most important really is that the idea of the broad spectrum of care, the comprehensive care that we provide. So many hospitals can give TPA through a vein, but what we can do here at Hershey is to be able to deliver some of these techniques through a catheter, to use these other surgical procedures, and treat some of these very unusual types of stroke that are not very commonly treated elsewhere.
Okay, thank you, Doctor. A lot of changes there coming up, a lot of excitement for the future there, too. Thank you for joining us tonight.
Thank you for having us.
We also want to thank you, our viewers, for sharing your stories and sending in your questions. If you'd like more information or would like to schedule an appointment with Penn State Hershey Stroke Center, just call 531-3828 or visit online. That's the easiest way to do it. We want to thank you for watching tonight, and as always, we wish you good health.